This is a video in clinical medicine from the New England Journal of Medicine.
This video demonstrates the use of eFAST, or Extended Focused Assessment with Sonography for Trauma, which is a point-of-care ultrasound examination performed in patients with a traumatic injury to the thorax or abdomen. eFAST involves obtaining images in 6 focused views to assess for pericardial, intraperitoneal, and pelvic fluid, as well as hemothorax and pneumothorax. Practice, preparation, and the use of a standardized approach can maximize efficiency and diagnostic accuracy when performing eFAST. Furthermore, it is important to document the findings in the medical record and to adhere to HIPAA regulations. HIPAA stands for Health Insurance Portability and Accountability Act and is a federal law in the United States that is designed to protect individual persons' medical records and other sensitive health information from being disclosed without the patient's consent. This video demonstrates one approach to the use of eFAST, but the technique may vary depending on the preference of the clinician, institutional guidelines, and the available equipment. eFAST is indicated in patients with a blunt or penetrating injury to the abdomen or chest. Although there are no contraindications to eFAST, the examination should not delay treatment in patients with an unstable condition who require immediate intervention. eFAST has limited sensitivity and a limited ability to rule out the presence of a small amount of fluid. When there are no findings on eFAST, the examination may need to be repeated if the patient's condition continues to deteriorate or if the clinician continues to suspect an abnormality. During eFAST, examination of the thorax, abdomen, and pelvis for the detection of free fluid should be performed with a low-frequency curvilinear or phased array transducer. Examination of the thorax for the detection of pneumothorax can be performed with a higher frequency linear or curvilinear transducer. In this video, a curvilinear probe is used to demonstrate all aspects of the eFAST examination. The following equipment should be available at the patient's bedside: an ultrasound machine, a curvilinear probe, and ultrasound gel. Ultrasound probes have a marker that indicates the orientation and corresponds to an indicator on the ultrasound screen. Awareness of the orientation of the probe is important when interpreting the images obtained. Before beginning eFAST examination, wash your hands and put on required protective equipment. Place the patient in the supine position, adjusting the bed or examination table to the level of your waist. While performing the scan, use one hand to manipulate the probe and the other hand to operate the ultrasound machine. You should obtain images with views focused on the pericardium, the right upper quadrant, the left upper quadrant, the suprapubic area, and the anterior thoracic cavity on the right and left sides. The order in which the images are obtained can vary, but a standardized approach should be used for every patient to maximize the efficiency and accuracy of the examination. You can optimize the quality of the images by adjusting the settings, including the depth, focus, and gain, throughout the examination. To obtain an image in the pericardial view, also known as the subxiphoid or subcostal view, hold the probe with an overhand grip and place it just below the xiphoid process. Position the probe in the transverse orientation with the indicator pointing toward the patient's right side. On the screen, locate the 4 chambers of the heart, the pericardium, and the liver. The liver acts as an acoustic window and enhances the image. The pericardial view allows for the detection of fluid in the pericardium, as well as identification of the type of fluid and its effects. To obtain an image of the right upper quadrant, place the curvilinear probe along the space between the right posterior axillary line to mid-axillary line at the level of the 8th to 11th intercostal spaces. Position the probe in the coronal orientation with the indicator pointing toward the patient's head. Locate the diaphragm, the thoracic spine, the liver, and the right kidney. Tilt the probe anteriorly and posteriorly to evaluate Morrison's pouch, which is the space between the underside of the right lobe of the liver and the right kidney. Slide the probe caudally to evaluate the tip of the liver and the superior aspect of the right paracolic gutter, which is the space between the ascending colon and the lateral abdominal wall. Slide the probe cephalad to visualize the diaphragm, the right subdiaphragmatic space, which is located between the liver and the diaphragm, and the right inferior portion of the thorax, using the liver as an acoustic window. Assess for the spine sign. Normally, the thoracic spine is visualized only caudal to the diaphragm because air in the lungs attenuates the returning signal from the spine. In the presence of fluid, such as hemothorax or pleural effusions, the spine will be visualized cephalad to the diaphragm. The right upper quadrant view will allow you to detect pathologic fluid in areas where fluid is likely to accumulate in a supine patient, including Morrison's pouch, the right paracolic gutter, and the subdiaphragmatic space. To obtain an image of the left upper quadrant, place the curvilinear probe along the left posterior axillary line at the level of the 6th to 9th intercostal spaces. Position the probe in the coronal orientation with the indicator pointing cephalad. Locate the diaphragm, the thoracic spine, the spleen, and the left kidney. Tilt the probe anteriorly and posteriorly to evaluate the spleen and perisplenic spaces above the spleen. Slide the probe caudally to visualize the left paracolic gutter, which is the space between the descending colon and the lateral abdominal wall. Slide the probe in a cephalad direction to visualize the diaphragm, the left subdiaphragmatic space, which is located between the spleen and the diaphragm, and the left inferior portion of the thorax, using the spleen as an acoustic window. Inspect the diaphragm and the left subdiaphragmatic space, which is the location most sensitive for the detection of free fluid in this view. Assess for the spine sign. The left upper quadrant view allows for the detection of pathologic fluid in areas where fluid is likely to accumulate in a supine patient, including the perisplenic spaces, the left paracolic gutter, and the subdiaphragmatic space. To obtain images in the suprapubic view, you will position the probe in two different orientations. First, place the probe immediately cephalad to the pubic symphysis and position it in the sagittal orientation with the indicator pointing cephalad. Locate the pubic symphysis, the bladder, and the rectum. In women, be sure to locate the uterus and the vaginal stripe as well. Tilt the probe left and right. In men, find the rectovesical pouch, which is the space between the bladder and the rectum. In women, find the rectouterine pouch, which is the space between the uterus and the rectum, and the vesicouterine pouch, which is the space between the uterus and the bladder. Next, place the probe immediately cephalad to the pubic symphysis and position it in the transverse orientation with the indicator pointing toward the patient's right side. Tilt the probe cephalad and caudal in order to find the same spaces as in the sagittal orientation. The suprapubic view will allow you to detect pathologic fluid in areas where fluid is likely to accumulate in a supine patient, including the rectovesical pouch in men, and the rectouterine pouch and vesicouterine pouch in women. To obtain an image of the thoracic cavity on either the right or left side, place the probe along the midclavicular line at the level of the 3rd and 4th intercostal spaces and position it in the sagittal orientation with the indicator pointing cephalad. This view will show the most anterior portion of the thoracic cavity, which is where extrapleural air is most likely to accumulate in a supine patient, and will allow you to detect a possible pneumothorax. Locate the ribs, rib shadows, and pleural line. Look for lung sliding, which is movement of the visceral and parietal pleura against one another during respiration. The absence of lung sliding may indicate pneumothorax, which is a disruption of the serosal membranes by the presence of air. Obtain images of the anterior thoracic cavity on both the right side and the left side to evaluate for pneumothorax bilaterally. On completion of the eFAST examination, disinfect the ultrasound probe and machine in accordance with the guidelines for low-level disinfection from your institution or the Centers for Disease Control and Prevention. There are generally no complications associated with eFAST. However, the acquisition and interpretation of ultrasound images can be limited by several factors, including the provider's previous experience, the patient's body habitus, and the presence of gas in the bowel, peritoneum, or mediastinum. It is also possible that the examination will lead to false negative or false positive results. Serial eFAST examinations, alternative imaging studies, or both may be warranted. Examining patients with the use of eFAST, or extended focused assessment with sonography for trauma, requires planning, preparation, and practice. Clear institutional guidelines can maximize the efficiency and accuracy of eFAST examinations and help to provide the best possible care for patients with acute trauma.